Debate in the House of Assembly continued today on the estimates. Wendy Burke joins us now with a report. Wendy.
Pearson, health was in focus today with the Ministry of Health and Wellness as it commits to the provision of cure for cancer patients moving to acquire a new linear accelerator. Such devices are most commonly used for external beam radiation treatments. Minister Dr. Jerome Walcott says a linear accelerator, though expensive, is something Barbados needs desperately and will acquire this year.
So you're speaking about almost $9 million. Maybe in Barbados dollars. And I know that already the QEH has received some substantial funding as it relates to the acquisition of this linear accelerator. So the process now is going through the ordering process and obviously outfitting the area where it will be placed. There are matters along its course with training. Our physicists, I think they've had some exposure to linear accelerator during their training, but obviously they will need some refresher, stuff like that.
Colombia has proven to be a cheaper option for Barbados as cancer patients are sent there for treatment. Director of Financial Services at the QEH, Adrian Hurley, revealed 15 patients to date were sent to Bogota for radiotherapy.
We have allocated about $265,000 coming out of the health levy, like the minister said, towards the treatment of those patients. What we are doing is we are using those funds as a stopgap to treat those patients as we transition for that period where we transition from the cobalt machine disassembly and decommissioning and the reinstallation of the installation and commissioning of the linear accelerator.
Deputy Prime Minister Santia Bradshaw urged health officials to place greater attention on patient education and support. While sharing her experience after her cancer diagnosis, Ms. Bradshaw says patients are scared to be diagnosed.
Being able to arm people with the information that allows them to manage their condition, because just because you have a diagnosis does not mean you're going to die. And I think that that needs to be the messaging that certainly is coming from the healthcare providers so that people understand how to cope. Now, yes, we have the other support services, but I do feel that whether it is internal or whether we are advocating for more people to be able to offer those services of support, perhaps the budget of the ministry needs to start to look at that more. I am on record as saying a large part of my recovery didn't just have to do with, I think, my positive approach to the condition, but it had to do with the people who supported me.
Leader of the opposition, Ralph Thorne, as he raised his concerns over the decision to appoint a CEO of the QEH, stated that young Barbadians and West Indians are being excluded from occupying high offices.
If you say that only 2 Barbadians applied, are you admitting that Barbadians do not feel inclined to apply because they feel that the position will not be made available to them? Minister, beg your pardon, Your Honor, to the minister through you, it is not only the Queen Elizabeth Hospital that is now afflicted with this cultural problem.
Amid concerns over the selection process for a new chief executive officer for the QEH, the Minister of Health is assuring the process was open. The Most Honourable Dr. Jerome Walcott made it clear that he did not interfere in the selection process. He was at the time responding to opposition leader Ralph Thorne, who raised his concerns.
I have had no role in it. The board met. They had their selection committee as members of the board. My PS was on the board. I believe the General Secretary of the NUPW was a member of the selection committee. They advertised, 84 people applied. I made the point, and it wasn't any publication, I made the point then, this was 2 days ago in the other place, that 84 people applied for this post. 2 were Barbadian. I was concerned about that. That's why I said it.
Pearson, that's it from Parliament today.
Wendy, thank you.